Here we are in IPSO and we want to talk about MBS. It's Metabolic Bariatric Surgery. So now I'm going to introduce you to Dr. Paulina Salminen. Am I right?
You're absolutely correct.
So thank you for being with us. You are from Finland, no?
Yes, I'm a bariatric surgeon and a professor of surgery from Finland.
So it's very nice to meet you and very nice to talk to you.
Thank you. Thank you for the invitation.
So could you briefly explain what metabolic and bariatric surgery is?
That's a very big question. Metabolic bariatric surgery is one of the means that we can treat severe obesity with. And that's why we are here gathered in this Chilean World Congress, is to help the patients with obesity. And when you look at globally, obesity is a global pandemic. We have that problem in all countries, all over the world. And what we are trying to promote is really get more people within active treatment, which currently we of course have multiple treatments, multidisciplinary treatments, and metabolic bariatric surgery is one of the most efficient treatment options we have that we can reach good and sustainable weight loss and remission of comorbidities that are associated with severe obesity.
So we have different kind of treatment, as you say, but most of people are taking drugs, or GLP-1 or Ozempic or Wegovy, semaglutide. So is one different? It's different than the surgery. The drugs are gonna kill the surgery? No.
On the opposite.
And the opposite way.
Because we have to remember that globally, when you look at it, out of the patients that would be eligible for surgery and would benefit from surgery, only 1 to 2% receive treatment. So access to treatment is very low. That means I don't know any other chronic disease that is so undertreated. So we literally don't treat 98% of the patients.
Wow.
That's wow.
Wow.
With the obesity management medications that we currently have, that just adds another tool in the box, because now with the medications we are able to get more patients within active treatment, but not all patients, especially with a more severe form of the disease. The obesity management medications are not enough, so we need more efficient means, and we do actually currently a lot of times use those two treatments together. So at the end of the day, I'm hoping that we will be increasing the number of patients within active treatment by having the OMM. So it's not going to kill surgery, it's going to actually increase the access to surgery and get more patients within active treatment.
What are the innovations related with MBS?
The innovations related to metabolic bariatric surgery, of course, are initially already way back when everything now we do laparoscopically. So it's a very safe form of surgery. The thing that we have to do is we have to, of course, continue exploring and doing research, so we know what happens with the patients that we treat with metabolic bariatric surgery, various different procedures. We're really aiming to reach a state that we would be able to tailor the treatments better according to different patients, and also how to best combine various therapies for that specific patient. So I think the maybe innovation, that's a strong word for the fact, but I think our main hurdle has been that obesity has not been understood as a chronic disease. So this year was the first time that we actually created, by the Lancet Commission, a framework for the diagnostics that people actually have this disease. It is a biological disease that affects a lot of other things and predisposes you to other diseases. So I think maybe identification of obesity as a chronic disease would be a key innovation and kind of the main thing that we have to keep on doing to help our patients.
So what criteria should determine when a patient is eligible from this kind of surgery?
Well, the patient, we do have very straightforward criteria.
Oh.
So currently, with the new guidelines that were published in 2023, so BMI over 35 by itself doesn't require any comorbidities, and that was actually lowered from 40. So BMI 35 and above patients are eligible for metabolic bariatric surgery. Of course, there are a few contraindications, but the majority of patients are suitable for surgery. And like I said, we evaluate all the treatment options within our practice to have the best possible combination for that specific patient.
Let's talk about obesity. What are the risks of the obesity?
The risks associated with obesity are of course clear. We know a lot of comorbidities that are associated with obesity, but obesity itself is already a disease, and that
Itself?
Yes, obesity itself is also a disease. Sometimes it is a disease even though you would not have any comorbidities,
Yeah.
but the comorbidities, the other diseases that it predisposes you to are of course type 2 diabetes, high blood pressure, dyslipidemia, so high blood fat values, cholesterol, sleep apnea. You may have younger patients that have polycystic ovary syndrome, so they may not be able to get pregnant. You have mechanistic issues with your joints, so arthrosis and all of that kind. I really don't know any organ system in a person that obesity would not have an effect on.
Beyond the physical benefit, do you see in your patient other kind of positive effect? I'm thinking about, I don't know, mental
Definitely.
situation, socially,
Of course,
psychologically.
obesity itself is very stigmatized, and that's really one of the kind of main obstacles in patients getting active treatment, because obesity is very stigmatized. Unfortunately, still, sometimes the patients, even from healthcare professionals, they may get this kind of, this is your fault, this is your lifestyle. It is, we know, and that when I say that we know, it means based on research, we know that it is biology. There are a lot of things that predispose some of us to obesity, including, for example, gut hormones. Like you mentioned, all the medications that are used today, they are gut hormones that the body actually doesn't give you normal signs of satiety, so you don't feel full. Similarly to somebody that's normal weight, you don't have the same hunger feeling, and that is the biology that those medications change. That's what surgery does too, very similarly. So it's not mechanistic. It actually is the mechanisms of action behind the surgery are very vast. And what you were asking about other outcomes, it is clear with the stigma that the patients have. We have multiple positive mental effects of improved quality of life after surgery, and I think I've done a lot of other kinds of surgeries during my career. This is now my main practice, but I don't think I've ever had the feeling that, you know, you're truly able to kind of change and help change somebody's life. Be a part of that journey, because the patients do it themselves. This is just a means that they need for that support.
You are from Finland.
Yes.
So can you tell us how is the situation about obesity in your country? Because here in Chile we are facing a very huge problem.
That's the same in Finland, unfortunately,
same?
and it's the same almost everywhere in the world. The obesity prevalence is still, it keeps on growing. Unfortunately, we are not at a plateau. That would be, even that would be a major step forward, but unfortunately the numbers are still increasing. So it is the same in Europe. Finland, as a Nordic country, is unfortunately one of the countries in Europe that we do really have an issue with this, but this is a global problem. That's why the World Health Organization has named this as one of the major global threats for health.
According with your point of view, we are talking about this very difficult situation we are facing. Your
Yes.
country, our country, we're super far, but we have the same problem.
Yes.
So, two questions. What we have to do? And the other question, what are the main causes according to your point of view? Is biological, is the lifestyle, the modern life, or all together?
What are the main causes for the problem? Like deep, I think this would be a very difficult question to answer shortly, but we know a lot of things that predispose us, and you're absolutely correct. The current situation that we now live in with food, high energy food available everywhere, there are a lot of things that we need to do in order to prevent this problem from getting bigger, and that's prevention. You have
Prevention.
Yeah, you have to distinguish prevention from treating the disease that already exists. Both are very important, but those really tackle different issues. And what we should do is, I think, we need to educate people. We need to educate all stakeholders. We need to educate patients, all the governmental offices that make the decisions, the policymakers, that we really need to treat this, because I often get the question is that how can we afford to treat this?
Exactly.
And I turn the question the other way around. We cannot afford not to treat it. We're going to be in so much, we're paying so much more, so we need to have patients in active treatment and increase that number to support that group of patients. That's how we end up, at the end, we end up saving money that would be cost efficient. And with this system, with all the healthcare systems in the world, I don't think anybody has unlimited resources, so we really need to use those resources to the best of our knowledge based on research.
Thank you so much for this conversation. It was very nice to talk to you.
Thank you very much.
Thank you for being with us.